Many people are concerned about taking a weight loss drug because of things like the rebound effect. That's where you pick up weight once you stop using the drug. Beth Galvin has more on what you need to know.
There have been a few studies looking at this rebound effect, that when you stop using these injectables, you're likely to regain much of the weight that you've lost. So we talked to an obesity physician from Wellstar about why this happens and how to prevent it. Weight loss injectables may be able to help turn down the food noise in your head. So obesity physician Dr. Alicia Shelley of the Wellstar Center for Best Health says you're not constantly thinking about food.
So you don't have this feeling where you wake up and you're like, what am I going to eat today? You're like, oh no, I'm up. Let me just eat something more healthier than what's just available.
But most people who start on a weight loss drug like this quit within a year. Last year, a Reuters analysis looking at pharmacy data from 2021 found only about a third of people who began taking Wegovy or a similar drug were still on it 12 months later.
When people stop taking the medication, they do have some weight regain. It's not, they don't go back to where they started, but they definitely see a difference. And the reason why this occurs is because their appetite comes back. They start feeling more hungry. They don't necessarily have that feeling of feeling full.
And a recent study found volunteers using tirzepatide, the active ingredient in the newer weight loss drug Zepbound, regained nearly 15% of the weight they'd lost on the drug within a year of stopping the injections. Another study found those who quit using semaglutide in drugs like Wegovy and Ozempic regained most of the weight they had lost within a year. And Dr. Shelley says that rebound effect has landed some of her patients with weight-related health conditions right back at square one.
And not only are they feeling more frustrated and more discouraged, their health outcomes are worsening. Their cholesterol is getting higher. Their sugar is getting higher. Their hemoglobin A1C is getting higher.
People may quit using a medication like this for a lot of reasons. They lose their health insurance or their plan changes, side effects, their weight loss plateaus, and cost is a big issue. For people paying out of pocket, the injectables can range anywhere from just over $1,000 to $1,400 a month, according to the discount drug website GoodRx.
But for some people, they may need to be on this chronically. And this is not just with these medications. You actually can see it even with lifestyle change. When people in a certain particular diet and lifestyle habits and they lose weight, when they stop, it comes back.
And Dr. Shelley cautions that these medications are designed to be used together with a healthy lifestyle. So if you're going to come off the medication, she says it's really important to keep up the other things you're doing, like exercising every day and eating a healthy, balanced diet, because those will go a long way in helping you prevent gaining back some of the weight. For your Fox Medical team, I'm Beth Galvin.